Welcome to today's lecture on Stargardt Macular Dystrophy, a rare inherited retinal disorder that primarily affects young individuals. In this lecture, we will explore the molecular mechanisms, imaging techniques, potential therapies, and impact on patients' lives associated with this complex disorder. Let's begin. Stargardt macular dystrophy is caused by ABCA4 gene mutations, disrupting retinoid waste clearance and leading to lipofuscin deposition in the retina. This causes macular degeneration and central vision loss. Understanding the molecular processes involved is key for developing effective treatments. Lipofuscin, a mixture of lipid and protein aggregates, accumulates in the RPE cells of those with Stargardt macular dystrophy due to impaired clearance mechanisms caused by ABCA4 mutations. This accumulation leads to RPE dysfunction, contributing to disease progression. Differentiating Stargardt macular dystrophy from other retinal disorders is complicated due to similar clinical features. Essential distinguishing characteristics include central vision loss, macular atrophy, and yellowish flecks at the RPE level. Age of onset, associated systemic findings, and genetic testing aid in confirming the diagnosis. Imaging techniques like optical coherence tomography, OCT, and fundus autofluorescence, FAF, help diagnose and monitor Stargardt macular dystrophy. OCT shows disruption of retinal layers and thinning, while FAF captures autofluorescent properties, revealing characteristic patterns in the disease. The clinical phenotype and disease progression in Stargardt macular dystrophy can vary widely among individuals, even within the same family. This heterogeneity can be attributed to variations in specific ABCA4 mutations. Certain mutations in the ABCA4 gene have been associated with more severe disease manifestations, an earlier age of onset, and a faster rate of disease progression. Additionally, specific mutations have been linked to distinct clinical subtypes, such as the flex-only phenotype or the bullseye maculopathy. Understanding the correlation between genotype and phenotype is invaluable for prognostic counseling and designing personalized treatment strategies for individuals with Stargardt macular dystrophy. Animal models have played a crucial role in advancing our understanding of Stargardt macular dystrophy and developing potential therapeutic interventions. Mouse models, such as the ABCA4 knockout mice, resemble key pathological features observed in human SMD, including lipofuscin accumulation, retinal degeneration, and functional visual impairment. These models have facilitated studies investigating the pathophysiological mechanisms underlying SMD and have served as valuable platforms for evaluating potential therapeutic interventions, such as gene therapy, pharmacological treatments, and stem cell-based approaches. The use of animal models continues to be instrumental in improving our knowledge of Stargardt macular dystrophy and exploring potential treatment options. In the 7th section, we discuss potential treatments for Stargardt macular dystrophy. This includes gene therapy, pharmacological interventions targeting pathways implicated in SMD, and stem cell-based therapies. These approaches offer hope for patients and are currently being extensively researched and tested in clinical trials. The use of nutritional supplements, such as vitamins and antioxidants, in treating Stargardt macular dystrophy is not yet fully supported by scientific evidence. While some studies indicate potential benefits, more research is needed to determine their optimal use and long-term effects. Mounting evidence suggests that inflammation plays a critical role in the development and progression of Stargardt macular dystrophy. Inflammatory processes, such as complement activation and recruitment of immune cells, are implicated in the pathogenesis of SMD, exacerbating retinal damage. Dysregulation of the immune response within the retina leads to chronic low-grade inflammation, contributing to the progressive degeneration of photoreceptor and RPE cells. Targeting these inflammatory processes holds promise for therapeutic interventions in Stargardt macular dystrophy. Modulating the immune response, inhibiting complement activation, or suppressing specific pro-inflammatory cytokines represents potential avenues for future treatments. Stargardt macular dystrophy is a rare eye condition that affects people worldwide. It is caused by mutations in the ABCA4 gene and is inherited in an autosomal recessive manner. The prevalence of the disease varies across populations, with estimates of approximately 1 in 8,000 to 10,000 individuals being affected. Certain populations with a higher frequency of consanguineous marriages may have a higher prevalence of Stargardt macular dystrophy. Understanding the global prevalence of the disease is important for public health planning and providing appropriate care for affected individuals. Growing evidence suggests potential associations between Stargardt macular dystrophy and other systemic diseases. Research indicates an increased prevalence of cardiovascular risk factors, including dyslipidemia and hypertension, in individuals with SMD. Moreover, studies have reported an increased risk of certain neurodegenerative disorders, such as Alzheimer's disease, in individuals with ABCA4 mutations. The shared pathophysiological processes, such as oxidative stress and lipid metabolism dysregulation, may contribute to these associations. Further research is needed to explore the underlying mechanisms and clinical implications of these potential links, establishing comprehensive care guidelines for individuals with Stargardt macular dystrophy. Individuals with Stargardt macular dystrophy and their families face numerous psychological and social challenges due to the progressive nature of the disease. Adjusting to functional limitations and obtaining psychosocial support is crucial for quality of life. Stargardt macular dystrophy is a complex disorder causing central vision loss and retinal waste accumulation. We studied molecular mechanisms, imaging techniques, genotypes, therapy, nutrition, inflammation, and psychosocial impacts to enhance diagnosis, treatment, and support systems for patients with SMD.